Now, I have the pleasure to introduce Alice Green and Sonia Kelly from Cleveland Clinic London to discuss how technology is supporting their nurses.
Today I'm going to talk you through how technology supports nursing at Cleveland Clinic London. So as we started our project and as we started thinking about creating a hospital in London, we needed to think about building a hospital not just for today but for the future. And so I'll talk you through some of our plans for our tools and technologies to make the life of the nurse a little bit easier as they go through their day and care for their patients. So Cleveland Clinic London is opening in September 2021. We will see our first outpatients in Portland Place. In January 2022, we'll open our 184-bedded hospital in Belgravia. We will have a multi-specialty hospital featuring world-class facilities with the latest equipment and technology. Our clinical focus will centre around institutes with a heavy focus on heart, vascular and thoracic, digestive diseases and surgery, orthopaedics and rheumatology, and neurosciences. We'll also have a 29-bedded ITU and 24/7 intensivists on call and on site. Cleveland Clinic London will use approximately 80 clinical applications for our facility. These are integrated heavily to ensure seamless workflows for our caregivers. So no more of logging into your lab system, then logging into your radiology system, and then logging into your EPR. We'll make that seamless so that everything is anchored around our one source of truth, which is EPIC, our electronic medical record. We'll use single sign-on for most applications, so that way you only have to enter your username and password once each time you log in, rather than using it each time you use a separate application. We believe this is really important because it'll save you time so that you can spend more time with your patients and less time staring at a computer screen. We'll also integrate some of our medical equipment. Again, this is designed for two things in mind. One, to make your life easier so you don't have to transfer data from a machine into another machine, but also from a patient safety perspective to avoid those fat fingers where you type a digit wrong and don't notice. Today I'm going to walk you through a day in the life of a nurse at Cleveland Clinic London. Now bear in mind I've really simplified this because what a nurse does every day is highly complex and sophisticated. And so I've simplified it down a little bit to make it easier to talk you through some of the tools and technologies we'll use to make people's lives easier. We'll talk a little bit about what access to systems you'll have before you come to work every day. We'll talk about when you arrive at work and get handover and what technologies we'll use to make that easier for you. We'll talk about what you can do when you assess your patient and how we'll support you in that. And also through our administration of medication process. We'll talk you through communication and how you contact other caregivers within the hospital. Something as simple as answering a call bell and all the technology we've put behind that. And then also hourly rounding and doing sets of observations and the tricks we have up our sleeves to make your life easier. So before you come to work, I know when I was a nurse at the bedside, one of the most important things my life centred around was my off-duty or my roster. So one of the things we'll do is make it easy for you to access this at home. You can access our time and attendance record through your mobile phone, your laptop or your tablet. And we do that to make sure you know exactly when and where you're working and to make requests and swaps outside of work, because 9 times out of 10, when you get an invite somewhere, you're not at work when that happens. You'll also be able to access our learning management system from home. This platform contains not just mandatory training, but also some continuous improvement and continuous learning opportunities. And so we want to make that available to you. So should you feel the urge to do some training on the tube on the way into work, you can do that. So once you get to work, you are looking to receive handover from the night shift. One of the most important things that we have at Cleveland Clinic London is our electronic medical record. We will use Epic for this. This is probably one of the most integrated electronic health records I've certainly ever worked with in my time. And the nice thing about Epic is it's fully integrated, not just from a nursing perspective, but multidisciplinary and across the whole patient journey. So if data is inputted in the outpatient clinic, such as an allergy, a date of birth, or a next of kin, that's already there for you when they come to stay with us in the hospital, to save you typing all that information in all over again. Epic will also help you clearly see your allocation for the day and what patients you'll be looking after, and also helps you see who is looking after the other patients in your area of work. Not just again the nursing staff, but also it puts who the physiotherapist, who the doctor, who the phlebotomist on that floor is today, all at the tips of your fingers. We have a number of things within Epic that makes it really easy for you to drive your care. We have a number of reports that are designed especially for your handover, so that you can make sure you tell the oncoming nurse or the offgoing nurse everything they need to know about your patient. And it's all laid out in a nice simple way, and that's easy to follow. We'll have lots of technology around our facility, both fixed on desks, the computers that you're used to, the workstations that you're used to. We'll also use things called WOWs, or workstations on wheels. And this is where you can pull your computer right up to your bedside and take that with you should you need it. So as we progress through your day and you look to assess your patient, one of the things that we have done within Epic is build in clinical decision support. We do this to help you deliver great care and keep our patients safe. We have best practice advisories that will pop up to warn you of things should they be about to happen. So for example, if you go to give your patient a dose of morphine and actually they've already gotten some earlier, you'll get a pop-up to say, wait, this medication isn't due right now. As you fill out your assessment, it will also look at the information that you are putting in there and help you make decisions. So if you put in, for example, the patient is at high risk of a pressure sore, and potentially that they have come in with a community acquired broken area of skin, it will give you a little pop-up to say, wait, there's no tissue viability referral on order for this patient. Is that something you'd like to do at this time? So it makes it nice and quick and easy for you to remember all the things that you're meant to do when multiple things are happening at once. Again, you can see everything in the one place with Epic. So you'll be able to see what yesterday's assessment was or the earlier assessment was really clearly. We do this in multiple ways. We can demonstrate to you in graphs if it's numeric values, or in what we call flow sheets, which are columns of information from yesterday or in the last hour or 2 hours ago. So again, all the information is at the tips of your fingers. Not just what your nursing colleagues have written down, but also what other disciplines like pharmacy or allied health have documented on the patient as well. So when it comes to administering a med for your patient then, Cleveland Clinic London will have the first fully closed loop medication administration system in the UK, and this is something we're really excited about. This will help us significantly reduce errors and prevent harm to our patients. As the doctor inputs the prescription into Epic, this automatically feeds through to our pharmacy department and our automated dispensing cabinets on our wards. We also will barcode every individual medication. So what that means for you as a nurse, it means that everything will be drawn up by pharmacy in advance, so it can have its own barcode for you to scan. The nice thing about that is there's no more drawing up 10 doses of Tazocin for the ward at 2 o'clock in the morning. This will all come to you pre-prepared by our pharmacy department. You can then retrieve the dose of medication that's due from our automated dispensing cabinet, barcode scan the med, barcode scan the patient, and that checks your 5 rights of medication for you and makes sure that you are giving the right drug at the right time to the right patient in the right way. It also will document it for you so that your documentation is accurate as well. This makes barcode med-admin or medication administration really quick and efficient for the nurse, but also really safe for our patients. You're working your way through the day, you have administered your medications, you've done your assessment on your patient, and you've received your handover. Now you want to contact the doctor because maybe you've picked up something along the way on your patient that isn't quite right that you need to tell them about. So how do you communicate with them? Gone are the pagers. We have gotten rid of those dreaded pagers, and we have done this to try and make your life easier. So in the old way of doing things, you would page somebody, you would stand guarding your telephone to make sure that nobody steals it if the person tries to ring you back, and then you wait until they call you. No, not at Cleveland Clinic London. We will use a communication device called Vocera. This allows you to send and receive text messages and calls through a handheld device that hangs around your neck like a little mobile phone or walkie-talkie. It can also send you urgent alerts should they be needed too. Through the Vocera device, you can press your button, and if you don't know who the doctor you're trying to call is, you can press your button and say, on-call intensivist. It will look to our on-call scheduling system, find who the right person is, and put you through to them. Their communication device rings immediately, and so there's no more waiting around to be in touch with somebody. Should they not be in a position to answer, it will automatically bounce on to the next person in the chain or allow you leave a message for them to call you back if it's not urgent. It also connects with our landline system so that you can ring both landlines and mobiles from your Vocera device, and you can ring a Vocera from a desk phone or a mobile phone by just ringing a simple number. Vocera also comes in a mobile app that you can have on your phone too. So, what technology will we use at Cleveland Clinic London for answering call bells? Call bells are probably one of the most important pieces of infrastructure we have in a hospital. These are your patient's lifeline, and so they're really important. For us at Cleveland Clinic London, we will connect our nurse call system with your Vocera device that you have around your neck so that you can connect instantly with your patient should they need you. Gone are the days of hearing a call bell, walking all the way to the room, finding out what the patient needs, walking to get it, getting distracted along the way. The patient rings their call bell again. You have to go all the way back again. At Cleveland Clinic London, your call will come through right to your Vocera. You can answer your patient, talk to them directly, find out what they need, and then save yourself the journey twice to the patient room and collect what you need on the way. Again, if you don't have the opportunity to answer the call, you're busy, you're on break, or you're with another patient, it will bounce to the next person in the chain so they can answer it on your behalf. Once you get to the room to turn off the call bell, one of the things that always drove me mad as a nurse was climbing over all the things that are in the room to get to the back of the bed. Pushing IV pumps out of the way, leaning over, trying to make sure you don't rip out an IV line at the same time. At Cleveland Clinic London, we will use the device you have in your pocket, your Rover device, I'll talk to you about next. The device in your pocket will be picked up by the nurse call system and will automatically turn off the light for you. Again, to make life a little bit more easy for you and save on the ergonomics of bending and twisting and the contortions you need to get yourself in often to get past all that equipment and patient's belongings to get into that button at the back of the bed. And finally, Rover. I mentioned it very briefly as I talked to you about our nurse call system. Rover is epic in your pocket. It is a handheld mobile device that you can document your care on. So rather than having to go and find a workstation on wheels, drag it into the room, protect it, save it from getting stolen by your colleagues, we'll give you a handheld device for your shift that fits in your pocket. Through that, you can document your OBS, your hourly rounding, administer meds, take pictures of a wound, lots of little quick and easy things to try and save you time staring at the screen. We'll also integrate some medical equipment, and our vital signs machines are an example of this. So again, rather than you typing in data, it automatically will flow in to your Rover device or your Epic Wow, whichever you have with you, and you can directly input that into Epic without having to type. We'll also integrate our ventilators, our monitors, our 12-lead ECGs, among other equipment. Ultimately, our job at Cleveland Clinic London as informaticists is to make your life easier. So we will work with our caregivers, our bedside nurses, to have their input on our IT systems in order for us to be able to continuously improve our systems all the time. Technology doesn't stay the same, nor does healthcare, and so if we're not updating our systems regularly, we're falling behind. And we will use our bedside nurses as our subject matter experts to guide and plan how we will use our technology in the future and how will we update the technology that we have. So expect continuous improvement at Cleveland Clinic London.
Here at Cleveland Clinic London, we are embarking on the highest journey of nursing excellence, the Global Recognition Scheme Magnet. Cleveland Clinic has been providing care for 100 years, with nursing being at the heart of care. The mission at Cleveland Clinic is caring for life, researching for health, and educating those who serve. Our vision is to be the best place for care anywhere and the best place to work in healthcare. Both our mission, vision, and values drive us collectively to create the best possible place for nursing with exceptional outcomes for patients. Within nursing specifically, our Cleveland Clinic nursing mission is to be the global leader in the professional practice of nursing through education, research, innovation, collaboration, and quality care where compassionate caregivers excel and patients are first. By combining the Cleveland Clinic's nurses' mission and Cleveland Clinic's vision and values creates the platform for exemplary, transformative practice, and Magnet recognition reflects our purposes in practice. Our commitment to our nursing caregivers is our commitment to the Magnet journey, to elevate our practice and profession. We are world-renowned for delivering great care, and this is shown through our multi-Magnet accredited healthcare organisations around the world. The Magnet framework ensures individual organisations puts nursing as an influential stakeholder, creating systemised, collaborative processes, giving nurses a strong and professional voice. This concludes in the creation of safer staffing, safer cultures, and improved outcomes. The recognition program was designed following research in the late 1980s in America to review why some hospitals could retain nurses. Its outcomes produced 14 themes, in which, if you attain all the themes, you would therefore retain nurses and have safer staffing. These 14 themes, latterly known as the 14 Forces of Magnetism, were developed into the Magnet program and introduced in the 1990s. By the year 2000, there was ample research to showcase its strengths not only in safer staffing, but also in producing cultures of quality and quality improvement. For example, by supporting safer staffing and creating safer cultures where staff are able to flourish, speak openly, and practice research and innovation, this created, on average across all Magnet-designated organisations, shorter lengths of stay, lower patient falls, lower hospital-acquired infections, and nurses reported feeling more satisfied in their roles and less likely to report burnout. These are just some of the highlights from the Magnet programme. In short, Magnet is an evolving programme with a mission to elevate patient care, in collaboration with the wider team where nurses are empowered to drive innovation and excellence. So why here in the UK? Though Magnet is still a US-dominated scheme with a good percentage of US hospitals accredited, of whom patients and top talented nurses are attracted towards, Magnet is not new here in the UK, and there has been a slow uptake, but now it's growing exponentially. Magnet is very much aligned to the principles and practice of UK healthcare, especially across the NHS, with multiple sites now going for Magnet's journey to excellence. This is the first level towards the full Magnet designation. In October 2020, after a 10-year journey, Nottingham Hospitals gained their Magnet status, and now the Magnet Programme Director at Nottingham, Dr. Kerry Jones, is working for NHS England as a senior nurse for workforce retention, with a key driver on the Magnet implementation. This is very much the focus of our NHS England Chief Nursing Officer, as well as many senior nurses across the UK. Magnet aligns closely with UK frameworks and regulation, from CQC to the NMC Code of Conduct. And many UK publications and committed UK academic commentators have wrote about Magnet's significance and effectiveness in the UK healthcare system. So what do they look for? As with the CQC, modern Magnet have now reduced their original 14 themes down to 5. The first principle is transformational leadership. This looks at a variety of drivers that helps nurses to be empowering leaders, giving them the tools to be change agents and trailblazers. Much research has showcased the correlation between nurses that have degrees and improved outcomes. Therefore, Magnet require that nurse leaders obtain a bachelor's in nursing, and if not, the organisation supports those to obtain a bachelor's in nursing as a minimum, giving nurses the critical skills and tools which are taught within a bachelor's. It is interested in highlighting nursing, empowering and inspiring nurses. So things like nurse recognition or nurse awards, nurses lifting up nurses, this is a key component. Transformational leadership is setting a nursing strategy and that being translated within all teams. Everyone speaks of the same language and everyone is here to provide outstanding care in the same uniformed way. Wherever you are in the organisation, you will receive the same outstanding care by nurses from the vision set by our senior nurses. The secondary key principle is structural empowerment. Having appropriate and stretching appraisals, having a nursing professional practice model, a visual to support the nursing strategy, co-designed by nurses to support the nursing image and voice. From the co-designed professional practice model, nurses are able to visualise their purpose within the organisation and the importance of their individual role and speciality. Magnet Hospitals want every nurse to know their value and place in the wider structure. So having clear, evident structures, even when there are dotted lines, ensures the nurse knows exactly where they fit. The third is exemplary practice. This is looking at our autonomous practitioners, advanced nurses, and how we govern and support our specialist individuals. This is about a systematic and fair way of supporting nurses in their continued education, how we mentor them. Exemplary practice is giving time for nurses to teach and build lasting and integrated relationships with wider teams. Innovation and improvement is next. This is about creating a culture, a real culture of continuous improvement and quality improvement. We do this by setting up nursing councils, giving nurses the time to work as a frontline team in a safe space without managers, without hierarchy or other leaders, to explore their department's issues and look at ways they can improve. This within Magnet is called shared governance, and it's not to be confused with quality governance, so things like M&M, which is an MDT process. Innovation and improvement also includes nurses being involved in research. We have to showcase successful projects with outcomes that show improved patient outcomes led by frontline nurses as well as nurse leaders. Nursing research is daunting for some, including me, and so the organisation has a focus on teaching tools for research and innovation, and a Nursing Research Council to give dedicated space for nurses to flourish within research, writing for publication and support with things like poster presentations. We want nurses to be proud of their work and to showcase this in ways that inspire others to do the same. Innovation is critical for Cleveland Clinic as a whole, but it's also critical for our continual role as nurses within healthcare, which is an ever-shifting picture that requires constant modernisation and improvement. By creating cultures of joy in innovation and improvement, this will help build resilience in the culture and continue to provide the best care. The final key principle is to showcase improvement across a set of nursing metrics. This is, but not limited to, things like nurse turnover rates, safer staffing in nursing, to pressure incidents and/or infection control. This is about benchmarking against the other organisations of similar size to yours, and then either improving or maintaining above the benchmark. This is why frontline innovation and improvement is so important, because the culture maintains or improves on excellence. A key nurse metric is on caregiver and patient experience. Our culture and our commitment to care is everything. We must have a regular pulse on how our teams and patients are feeling, both in real time and within reports. from patient feedback forms to nurse feedback reports, similar to NHS staff survey or FFTs. By committing to the 5 key principles we just spoke about, this in turn will create outstanding cultures and care. Every process I've given a short overview on is a whole multidisciplinary approach. It requires significant corporate nursing project management, committed leadership support, and a devoted executive drive, especially from the chief nurse. However, the scheme is about the entire nursing population within the organisation, and so every single nurse at every single level must be signed up for Magnet, signed up for the single goal of excellent patient care. So I urge you, if you take one thing away from this session, it's that Magnet is here for you. It's not a hindrance, but it's here to create the best in you and the best care that you can deliver. Magnet is a journey, and it continues long after accreditation as the programme gradually intensifies, showcasing quality, safety, innovation and teamwork in a clear evidential report is the first step, but Magnet's final process is to review to understand if the Magnet culture really exists within our nursing caregiver teams. Did what we say in our report show up in the teams qualitatively? Do the teams really know what great quality is? Can they demonstrate it? We at Cleveland Clinic London are on our Magnet journey now, and we aim to get accredited by 2024-25, but the journey doesn't stop at the accreditation as the process repeats, and we must show improvement to maintain our status, and that's the beauty of Magnet, to continue to elevate excellence in nursing practice. Cleveland Clinic London is committed to demonstrating and living our values every day of quality and safety, empathy, inclusion, integrity, teamwork and innovation. And Magnet aims to enhance our everyday practice and values into tangible outcomes, both for nursing caregivers and our patients. I hope you too feel as energised as we do around Magnet, and we hope others follow on the journey that so many of us in the UK are on. Thank you.
Good afternoon to Alice and Sonia. Great to have you here. As ever, audience, please send me your questions so I can ask them on your behalf. We've got around 10 minutes now, so plenty of time to get through lots of interesting discussion and questions. So, just a sort of scene setter. Cleveland Clinic are relatively new to the UK, aren't they? Where are you on your journey towards opening?
Do you want me to answer that, Sonia?
Sure.
We actually are about to open our outpatients building in September, so really exciting. We're just starting now to hire in our nurses and train them for September, and then our main hospital site is opening in February 2022. So really exciting, and it's all go.
Fantastic. And this is leading in from a question we've just had in. What sort of nurses are you looking for? Any types in particular, or the whole lot? Basically, Precious has asked, are newly qualified nurses welcome?
Yeah, everyone is welcome to apply. We have lots of different roles at the minute. We have recruited, I think, probably about 70-80% of our nurses, but we are still looking for more nurses at all levels. So get on our website and have a look. And I think our team are here today anyway, who have a stand with us, with you guys.
Yeah, no, there's definitely a stand here. So yes, audience, if you're interested, go and talk to them, basically. So yeah, just looking at the presentation, you've explained about Epic and Rover and use of barcodes and things, which they sound really exciting developments. I suppose just thinking about sort of the audience in general, are they easy for nurses to use? Sort of, have you had what's feedback been like in places where they are being used?
Absolutely, that's a great question. I think one of the things that we've watched as technology has evolved in healthcare over the last few years is we've made life very difficult for ourselves. We've developed systems that are very complicated, and really they don't need to be. I kind of use the apps that are in everyday life as kind of a guide. You can download a grocery shopping app. Nobody teaches you how to use that, but yet you can go on there, spend a couple of £100 on groceries and have it arrive at your door the following day. and yet there's no training around that. And that was kind of our guiding principle as we developed all of our technology, is it should be really straightforward and easy. And if technology is not making your life easier, then you're doing. So we tried to design them as simply as we can and make it as intuitive and as easy for the end user as we can. And then we build in a very robust training program around that as well. So all of our nurses will go through EPIC training. And then once we are live, or once we do start seeing patients and people get through their training and then start taking care of people, we do have a team of people that will then wander around our nursing floors, checking in with folks, finding those people who are frustrated and crying in the corner that the system is just driving them mad, and help them and give them a little bit of one-to-one, a little bit of one-to-one love and care.
Great, sounds good. So just on that sort of similar note, I suppose, how important is it, do you think, to involve nurses in the developing and rolling out of technology in general?
I really think it's just vital. And I think, again, one of the lessons that we've learned as we looked at technology in healthcare over the last number of years is what's been happening is leadership have been the ones to choose those pieces of software. Leadership have been the ones to design those. And then they hand them to the bedside nurse and expect them to make that work. And really, that's how we've ended up in this really complicated situation. So for us, having feedback from the person who actually uses the system every day, that's the most important piece. That's how you develop systems that are meaningful and actually work for the end user. I think when you start looking at Magnet and putting it together with technology, I think that's where the opportunity lies. So having these shared governance councils that have representation from an ICU bedside nurse and a ward bedside nurse, outpatient nurse and an endoscopy nurse, and having these people sit together and discuss, if we're going to make a change to the vital signs flow sheet or the intake and output flow sheet, making sure that everybody is aware of what impact that's going to have on their day. Because all too often we make a change in one area of the hospital that impacts everywhere else, but nobody else thinks to tell them or talk to them about it. And so by bringing everybody together and by bringing the people who actually are using the system and knows whether it's any good or not, is where we'll get great value and true improvement and true continuous improvement.
Great, thank you. We've just had a question in from, let me look, hang on, just coming up now, from Sedalia. I hope I pronounced that right. And they ask, how do you plan to integrate changes in the system based on frontline feedback? So I guess that's looking forwards, as in once the technology is out there, can it be altered? I think that's probably, if I
yeah, absolutely, right? It can. So we will have kind of two ways of doing that. One, we are developing a group of super users. We'll call them ambassadors, but they are kind of super users who got a little bit of extra training on the system. We are really hoping that they'll be our eyes and ears on the ground. I think when we look to other organizations, where we see them fall a little bit is everybody in the nursing teams are giving out about the IT systems, but nobody gives out about the IT systems to IT. And so IT sit back and they, oh, they've lovely, it's great, we did such a wonderful job, and actually everybody on the floors hate it. For us, our ambassador groups are our eyes and our ears. They are going to be the folks that come to us and say, you know what, this piece of tech is driving the nurses mad, it's delaying discharge, it is causing us consternation, it needs to change. So we'll use that group to help us identify challenges and issues. And then our shared governance structure will help us prioritize those issues. So again, it should not be an IT person sitting in an IT department who's making a decision about whether we should change the vital signs flow sheet first or the intake output flow sheet first. That has to be the people who are using it every day. And so we'll use our shared governance committees to help us prioritize those changes so that IT know exactly which project will get us bigger bang for our buck, which little change will make life easier for our nurses, and therefore we should focus on that first.
Great, thank you. We've had another question in on recruitment, so it might be one for Alice. So Ariva asks, again, this is referring back to the question that came in earlier. I think Ariva asks, does the Cleveland Clinic run preceptorship programs for newly qualified nurses, and if so, how long?
I think for the when we first open, we are just looking at just opening up, and I think as we go along, we're going to be then looking at our preceptorship program, student nurses, newly qualified nurses. So for that initial kind of opening, preceptorship isn't really on our path, but it will be later on.
Yep. Okay, great. Thank you very much. And another technology one from me. Obviously, you mentioned the getting rid of the pagers and working with Vocera on that. People get strangely to things, even if it's outdated technology. I mean, has it been a smooth process? People been on board with this?
Absolutely. It has actually been a roaring success. I was very hesitant when I saw that technology first. I kind of thought, you know what, it's going to drive me mad. It's going to be binging at me when I'm trying to mind a patient. It's going to be interrupting. People love it. It's one of those things that has just become an integral part of our culture. And so it is just instant connection with people, and it just saves so much time trying to find, everything from trying to find who's on call to actually there's cake in the tea room, pop in. It makes everything so much quicker and easier from a communication perspective. We've found that our nurses absolutely love it in the States. Same in Abu Dhabi, they just took to it like a duck to water. And so much so that when we suggested we take away the badge and just give them the app on the phone, there was nearly a riot. They just would not live without it. There was us thinking it would make their life easier just to have one device, but no, they wanted both, and so that was where we left it. They have the app on their phone and they have their badge around their neck, and they love it. Great,
that's good to hear. So we're almost out of time, so we've got one more question I think I'll throw in, which is basically I'll give you the opportunity. So if you had to sell the Cleveland Clinic to me as somewhere to work, what would you highlight? What would be the key thing or things that you'd tell me?
Ooh,
I think for me, just the culture. I think the culture is absolutely fantastic, and everyone is signed up for safety first. Everyone is signed up for a flatter style of working where every voice matters. So that would be mine.
Yeah, I'm very similar. For me, it's we are what we say on the tin. I've worked in hospitals before that had patients first as a mantra, but it was just something on a wall. For me, it's the fact that we live and breathe that every day, and it is who we are.
Great, a perfect place to stop. So thanks again to Alice and Sonia. Really interesting presentation. We've now got a short content break, and we're back here at 1 o'clock, I believe, for our final content session, which is the student reception. See you then.